There have been some terribly sad stories of loss here in Australia through this coronavirus pandemic. 63 people have lost their lives. But Australia continues to fare comparatively well in efforts to control the spread of the virus. We've had a few states report their numbers this morning and they continue to be relatively low. The contrast with the US is stark. It's headed for yet another day of staggering loss. There were 2,400 people who died 2 days ago, and that number has been exceeded again. Just in the last 24 hours, it finished about an hour ago. So that death toll in the US in the last 24 hours, at least 2,480 people. We keep on hearing from US officials that the worst appears to be over, but the carnage continues day in, day out. Here are today's key developments in the coronavirus pandemic. The number of confirmed cases worldwide has passed through 2 million. Almost a third are in the US. It took 83 days to reach the first million cases and just 2 weeks for the second million. Keeping teachers safe at schools is on the National Cabinet agenda. Leaders are looking at ways to protect staff and students and plan how and when all kids can return to the classroom. 5 more residents have been infected at a Western Sydney aged care home where an employee tested positive. It was initially reported she had flu symptoms, but it's now said she was asymptomatic. The head of the World Health Organization says he regrets Donald Trump's decision to pull US funding. Billionaire Bill Gates, whose foundation also funds the agency, says the move during a crisis was as dangerous as it sounds. And Germany will slowly ease restrictions. As of next week, shops under a certain size will be able to open their doors. In Denmark, children up to the age of 11 are returning to school as Denmark becomes the first country in Europe to relax rules on education. So let's take a look at a few of those elements in detail now. How and when students can return to school in Australia will be the focus of today's National Cabinet meeting. Leaders will also discuss how to start lifting restrictions once the crisis passes. Here's political reporter Jade McMillan.
This has been a very confusing issue for parents. The Prime Minister, Scott Morrison, insists, as he has done right throughout this pandemic, that the medical advice to the government on schools has not changed, that it is safe for them to be open. But it's really up to the states and territories then to decide how they manage the schools in those areas. And everyone seems to agree that there does need to be face-to-face learning provided at the moment for students who can't learn from home, for example, vulnerable students or students whose parents need to physically attend work. But there's differing opinions about exactly how and when the majority of students should return to school. So this is on the agenda for National Cabinet today. In particular, leaders will look at the practical ways that teachers and students can be protected. Some teachers have expressed concerns about personal protective equipment and how to maintain social distancing rules in a school setting. The government says that some of the suggestions made so far to try to deal with that include having hand sanitizer in schools, having extra hand washing, and also things like staggering lunch breaks so that we don't have large groups of students at any one time, as well as protecting more vulnerable teachers, so teachers who are older, perhaps working in different roles rather than in the classroom.
And what else is on the National Cabinet agenda today?
Well, leaders are also expected to look more broadly at some of the restrictions that have been placed on Australians during this pandemic and how and when they might be lifted. The Health Minister, Greg Hunt, has told Channel 9 that the measures that Australia has taken so far are working to flatten the curve, but he's urged people to be patient. The last thing the government wants to see is a second wave of cases. But he says leaders will look today at how and when some of those restrictions can be eased if the number of cases continues to fall.
That means that we are in a position now where over the coming weeks, if we can be stable, further reduce, further suppress the number of cases, we can then look at the pathway out. And that's exactly what the National Cabinet is doing today. They are starting to plan that pathway out. There's been an enormous amount of thinking going on. What are the low health risk, high benefit outcomes both for the community and for the economy that we can progressively take. So that work's going on, and that's a result of the difficult but life-saving steps that Australians have taken.
And Jade, the US President Donald Trump has had a fair bit to say over the past 24 hours or so about the performance of the World Health Organization through this pandemic. What's the Australian government's take on the WHO's performance?
Well, the Australian government says it won't be following Donald Trump's lead and halting funding to the World Health Organization. But the Treasurer, Josh Frydenberg, has said several times in the past couple of days that Australia and the WHO don't agree on everything. Yesterday, he criticised its position on China's wet markets reopening. He said that the WHO's position on that was extraordinary. And today he has accused the organisation of making several significant mistakes in its handling of this crisis, and he's pointed to a number of decisions that Australia has made along the way which were ahead of the WHO.
Jade McMillan there. There continue to be promising signs that efforts to control the spread of coronavirus in Australia are working. 3 states have this morning reported relatively low numbers of new cases in the past 24 hours. In New South Wales, it was 11. Reporter Lara Hyams has more from Sydney.
These 11 new cases are an improvement in the daily figures of coronavirus in New South Wales. However, almost half of them are linked to an aged care facility. This particular facility is located in Sydney's western suburbs, near the suburb of Penrith, and the source of the spread has been linked to a part-time staff worker. It appeared that she was asymptomatic at the time she was carrying out her duties. She had infected 6 colleagues and 4 residents. The new figures show that she has spread the virus to an additional 5 residents, bringing the total number of people to 15 at that particular facility. Police did carry out some inquiries and they found that there was no malfeasance in the staffer's behaviour, and it said that she had been mortified that she had been carrying the virus and spread it to the people around her. She was actually identified as having the virus after testing took place, after she was identified to have come into contact with a person who already had the virus. This morning, the New South Wales Premier Gladys Berejiklian has reiterated the message of testing, particularly of people who are near communities where there have been clusters of coronavirus. She says that the testing regime has an objective to get to about 4,000. Currently, testing stands at about 3,000 residents.
So obviously, if you live in a suburb we've identified and you think you might have symptoms, or you're in direct contact with someone or were who now has the virus, please come forward and get tested. But across the state, if you're someone who works with vulnerable people or someone who's been in direct contact with someone or feels they've got symptoms, do not hesitate to come forward and get tested.
This all comes on the back of a new website that has been developed by Sydney University researchers using data from New South Wales Health and also the ABS, the Australian Bureau of Statistics. This website is publicly available information and is used to help identify where these clusters and cases of coronavirus are. Currently, the main hotspots are still around the eastern suburbs, Bondi having the highest number of cases. The objective of using this website is to identify where there might be vulnerable populations which can enable higher testing regimes. It can also assist the government in developing strategies on how to relax the quarantine measures.
Lara Hyams reporting there. World leaders, doctors and diplomats have attacked Donald Trump's decision to suspend US funding for the World Health Organization. The US President has blamed the WHO for failing to do enough to stop the spread of coronavirus. The organisation's Director General says President Trump's decision is regrettable.
The United States of America has been a long-standing and generous friend to WHO, and we hope it will continue to be so. We regret the decision of the President of the United States to order a hold in funding to the World Health Organization. With support from the people and government of the United States, WHO works to improve the health of many of the world's poorest and most vulnerable people. In due course, WHO's performance in tackling this pandemic will be reviewed by WHO's member states and the independent bodies that are in place to ensure transparency and accountability. For that matter, involving all responders. This is part of the usual process put in place by our member states. No doubt, areas for improvement will be identified, and there will be lessons for all of us to learn. But for now, our focus, my focus, is on stopping this virus.
But President Trump has repeated claims that the agency's opposition to his early restrictions on Chinese travellers cost lives.
Took them a long time to realize what was going, but I have a feeling they knew exactly what was going on. Tragically, other nations put their trust in the WHO and they didn't do any form of ban. And you see what happened to Italy, you see what happened to Spain, you see what happened to France. WHO's guidance had failed to control their borders at a very crucial phase, quickly unleashing the contagion around the world. That was a horrible, tragic mistake, or perhaps they knew.
And a former lawyer for the World Health Organization has conceded that China likely concealed and obfuscated information about the virus, but says challenging China's narrative would only have made Beijing dig its heels in.
I mean, the criticism about WHO having been too China-friendly in January have come from several quarters. By now, even though it's a bit anecdotal, but it seems confirmed that China suppressed and obfuscated and concealed for a good month and a half. So I think that's a fact. The Chinese will always deny it, and they're able to control the narrative, so they're trying to erase history. But there's enough evidence. But when they decided to cooperate, what was the point in Tedros to say, yes, you're cooperating now, but we heard you concealed before, so shame on you, shame on you. What would we have gained? I think nothing. We would have actually forced China to posture and maybe to be less cooperative.